My name is Angela Keller and I've been a member of St George's Congregation all my life. Many of you will know that I work as a nurse at Bolton Hospital and that the field that I specialise in is infection prevention and control. I've done this for approximately 15 years at various hospitals, and a huge amount of my work involves educating staff, patients and visitors of the importance of cleaning properly and washing hands correctly at the right times to limit infections and stop them from spreading from person to person. I can honestly say that I performed hand hygiene all the time, even before it was popular. Scientists have always warned the world that it was at risk of a pandemic infection that would spread across the entire globe very quickly, and it's always been something that healthcare has been aware of and had plans for. But the current COVID pandemic was completely unprecedented. It was, and is, a new disease to man and doesn't behave in the usual way that previous viruses have done. It's been a huge learning curve for everybody across the world, and advice on what to do to keep us safe has changed as scientists have learned more about this virus and how it is spread and the effects it has on the human body. The behaviour of the population has also had a massive effect on the progression and effects of the virus. Globally, countries including the UK were put into lockdown, which meant for a lot of people that they were allowed to leave their home only for essentials like shopping and medical care. For me personally, it's meant that I have had to go in work as I'm classed as a key worker being a nurse. My husband James is also a key worker, working in the rail freight industry. Our sons, Robert and Sam, must attend school when we are both in work, as families are on lockdown and there is no one else who can look after them whilst we are at work. We've both worked through what should have been 2 weeks of annual leave to help cover a sudden increase in workload and also to cover days when our colleagues have had to self-isolate at home. At the hospital it's been stressful and busy, with a sudden increase of patients presenting with respiratory symptoms. A lot of these patients were unfortunately so poorly that they were unable to survive the illness. The number of patients admitted without COVID symptoms reduced massively as people were frightened to leave home and they were even more frightened about going to hospitals. Wards were changed to nurse specific groups of patients depending on their diagnoses and symptoms, and the intensive care bed capacity was increased to manage people who required special support. As reported in the media, initially there were problems with the provision of PPE to all hospitals, and we were overwhelmed by support from local people and businesses who donated masks and eye protection amongst other things to help protect our frontline staff. PPE is no longer an issue, and all staff now wear face masks for every single patient contact. This can be confusing and upsetting for some patients. A wonderful thing to come out of lockdown was the Thursday night clap for carers, which meant so much to me. It gave a sense of compassion, consideration and belonging, and it was very emotive for me and my colleagues. I'd be lying if I said that tears hadn't been shed as a result. It meant an awful lot to an awful lot of people. In addition to work stresses, there have been huge stresses at home. Those of you who know me will be only too aware that my mum, Sylvia Thomason, has been unwell in recent times, and she's had 2 stem cell transplants in the past few years. These transplants have saved my mum's life, but they've also left her extremely vulnerable to infection. She's officially classed by the government as being in the extremely vulnerable group of people who need to shield at home from COVID. This has meant that my mum, Sylvia, and dad, Ian, are effectively locked away in their house and garden. They're unable to risk any contact with anyone. Any person who has been in contact with COVID would be a significant risk to my mum's health. Evidence to date indicates that people can incubate the infection for up to 14 days without displaying any symptoms. The virus is known to survive for days on surfaces, and it can be spread in the air if anyone coughs or sneezes, so the risk of being with people is just too great for my mum and dad. Like many people, I'm now a personal shopper for my family, and every day I collect a newspaper for them. And I know that I'm lucky because I can see my mum and dad, albeit at a distance. In some ways, the isolation is easier for my mum because she's gone through isolation periods before when her immune system has been wiped out by chemotherapy. But in other ways, it's harder because of all she's been through, and this time is precious, and we should be able to be together and doing things together as a family. I'm going to finish by giving a quote from Facebook that says, "We're all in the same storm, but all in different boats." Some people, like me, are at work and under pressure due to the uncertain times and demands that COVID brings each new day. Others, like my mum, are shielding and living as best they can away from the outside world. Lots of families are homeschooling and children are missing out on vital social interactions. It's hard for everybody in different ways, and we must all try to be kind to each other. We will get through this and we will come out the other side, but unfortunately we don't know when that time will come. Up until when we reach that point, all we can do is follow the advice, socially distance ourselves, keep up with hand hygiene and look after each other. Thank you.